Hi there, viewers. Alarmingly, nearly 94 million US adults aged 20 or older have borderline high cholesterol. The waxy substance known as cholesterol, which may be found in your blood, is an essential component in the process of constructing healthy cells. While essential for various bodily functions, excessive cholesterol levels may be a silent harbinger of severe health risks. This staggering figure underlines the importance of maintaining balanced cholesterol levels. When cholesterol levels tip the scale, they pave the way for fatty deposits in your blood vessels. These deposits grow, making it difficult for enough blood to flow through your arteries, potentially leading to heart attacks or strokes. However, we contribute to an increase in the level of cholesterol by consuming certain foods that are high in fat. In today's video, we've explored 10 foods that are highly dangerous for our health due to their enormous cholesterol buildup. Always consult a dietitian or a healthcare advisor before making any changes to your diet. 1. Red meat. If you are a fan of red meat, then you might have exposed yourself to a higher level of cholesterol. Red meat, particularly when consumed in large quantities, may contribute to an increase in cholesterol levels due to its high content of saturated fats. The saturated fats present in the meat are digested in the stomach and intestines. Since the majority of these fats are not water-soluble, lipoprotein molecules transport them in the blood to the liver. This organ synthesizes cholesterol. When the bad cholesterol level rises, it may accumulate in the walls of the arteries. Over time, this leads to the formation of plaque, a thick, hard deposit that may narrow the arteries, increasing the risk of cardiovascular events such as heart attacks and strokes. In a comprehensive study involving around 20,000 participants, the impact of red meat consumption on dyslipidemia was thoroughly examined. The study found a significant association between higher red meat consumption and increased risks of hypercholesterolemia, which was about 34%. For this reason, individuals ought to be mindful of the amount of red meat they consume in order to improve their health. 2. Butter. Butter is rich in saturated fats, which are known to influence the body's cholesterol levels. Unlike unsaturated fats found in plant-based oils, saturated fats are more likely to raise blood cholesterol levels. When you consume butter, such fats are digested and absorbed into your bloodstream. The absorbed saturated fats reach the liver, where they significantly influence cholesterol production. The liver uses these fats to produce more low-density lipoprotein cholesterol, often referred to as bad cholesterol. LDL cholesterol is responsible for transporting cholesterol to various parts of the body. However, when its levels in the blood are high, it may lead to health issues. In a study involving 47 healthy individuals, the effects of substituting a part of their habitual diet with butter or refined olive oil were analyzed. The study, which included a 14-day run-in period of habitual diet, primarily involved 70% of women with an average age of 40 years. Results indicated that butter intake significantly increased total and LDL cholesterol levels more than olive oil. However, it also raises HDL cholesterol compared to the habitual diet. Therefore, while people with hypercholesterolemia should minimize butter consumption, moderate intake may be acceptable for those with normal cholesterol levels. 3. Fried foods. Well, if you love fried foods, you might need to check your cholesterol levels soon. High temperatures used in frying may cause the oxidation of fats, leading to the formation of harmful compounds that negatively impact cholesterol levels and heart health. This oxidation process not only alters the chemical structure of the fats, but also creates substances like aldehydes and free radicals, which contribute to inflammation and oxidative stress. Additionally, when foods are fried, they tend to absorb these altered fats, increasing the overall intake of unhealthy saturated and trans fats. This absorption exacerbates the intake of fats that are detrimental to health. In a large prospective study of about 15,000 participants, the relationship between fried food intake and heart failure risk was examined. Those who consumed fried foods more frequently than once a week had a higher risk of developing heart failure, according to the findings of the study. The risk increased by 24% for those who consumed them between 1 and 3 times per week, a 28% increase for those individuals who consumed them between 4 and 6 times per week, and on top of that by more than doubling the risk, which is roughly equivalent to an increase of approximately 103%. 4. Processed meats. Not only red meat, but also processed meats such as sausages, bacon, and deli meats contribute to increased cholesterol levels primarily due to their high content of saturated fats and, in some cases, trans fats. The liver then processes these fats and increases the production of LDL cholesterol. Furthermore, processed meats often contain high levels of dietary cholesterol, which may also contribute to raised blood cholesterol levels. The combination of high saturated and trans fats, along with dietary cholesterol, makes processed meats particularly impactful on cholesterol levels and cardiovascular health. Regular consumption of processed meats may therefore significantly contribute to higher cholesterol levels and associated health risks. A review of studies showed that processed meats, which include added sodium and preservatives, show a higher risk of coronary heart disease, with a 42% increase in risk per 50 grams consumed compared to unprocessed meats. The high sodium content in processed meats, about 4 times higher than in unprocessed meats, accounts for much of this risk difference. Factors like heme and dietary cholesterol in these meats may contribute to these health risks. These findings suggest that processed red meat consumption is not ideal for heart and metabolic health, with a particular emphasis on reducing processed meat consumption for better health outcomes. 5. Whole fat dairy products. Dairy products have always been under scrutiny due to their potential contribution to the increasing risk of cholesterol. Whole fat dairy products contain a high amount of saturated fat. Saturated fats are absorbed into the bloodstream and transported to the liver. After that, the liver makes use of these fats in order to produce additional cholesterol. Additionally, many whole fat dairy products contain dietary cholesterol, further adding to the body's cholesterol levels. The combination of saturated fats and dietary cholesterol in whole fat dairy products makes them significant contributors to increased cholesterol levels, particularly when consumed in large quantities. However, individual responses to dietary cholesterol vary, with some people being more sensitive than others. For example, in a study on men and women with metabolic syndrome, a diet rich in full-fat dairy showed no effects on fasting lipid profile or blood pressure compared with diets limited in dairy or rich in low-fat dairy. Therefore, dairy fat, when consumed as part of complex whole foods, does not adversely impact these classic cardiovascular risk factors. 6. Egg yolks. Egg yolks are known to potentially increase cholesterol levels due to their high content of dietary cholesterol. However, the extent to which dietary cholesterol from egg yolks raises blood cholesterol levels may vary significantly among individuals. For some, the impact is minimal, while for others, particularly those who are more sensitive to dietary cholesterol, egg yolks may cause a noticeable increase in low-density lipoprotein cholesterol, often referred to as bad cholesterol. Moreover, dietary cholesterol increases postprandial lipemia and potentiates the adverse effects of dietary saturated fat. That's why it should be limited to less than 200 milligrams per day. A single large egg yolk contains approximately 275 milligrams of cholesterol. Among participants who became diabetic during observation, consumption of 1 egg a day doubled their cardiovascular risk compared with less than 1 egg a week. 7. Shellfish. Similar to egg yolks, shellfish, including shrimp, lobster, and crab, are known to increase cholesterol levels due to their relatively high content of dietary cholesterol. For those who are genetically predisposed to high cholesterol, eating shellfish may lead to an increase in blood cholesterol levels. Elevated LDL cholesterol is a concern because it may contribute to the increasing risk of heart disease and stroke. However, it's important to consider that shellfish also contain beneficial nutrients and are generally low in saturated fat, which is a key factor in cholesterol levels. Therefore, the impact of shellfish on cholesterol levels may depend on the overall dietary pattern, the quantity consumed, and individual health factors. In a study, the impact of non-cholesterol marine sterols found in molluscan shellfish like oysters and clams on cholesterol absorption was investigated. Although there was no significant difference in total plasma cholesterol, the ratio of HDL2 to HDL3 cholesterol was higher after the oyster clam diet. This study suggests that the marine sterols in shellfish like oysters and clams might reduce cholesterol absorption, offering potential dietary benefits. That's why eating shellfish in moderation is often recommended, especially for individuals concerned about their cholesterol levels. 8. Fast food. Many fast food items are prepared with ingredients high in saturated and trans fats, such as deep-fried item, processed meats, and full-fat dairy products. Fast food meals tend to be high in calories. High caloric intake may lead to weight gain and obesity, which are risk factors for high cholesterol. Many fast foods are also high in sodium and sugar, which may contribute to hypertension and inflammation, exacerbating cardiovascular health issues related to high cholesterol. Fast food often lacks essential nutrients like fiber, vitamins, and minerals. A diet low in fiber is particularly concerning for cholesterol management, as soluble fiber helps reduce the absorption of cholesterol in the bloodstream. In a study of 200 university students, over 3/4 regularly ate shawarma, a type of Mediterranean fast food, at least once a week. About 44% of these students had an increased body mass index, and approximately 37% had elevated serum cholesterol levels. The study found that frequent consumption of fast foods and a higher BMI were strong indicators of high cholesterol. Specifically, students who ate shawarma more than 3 times a week were 8 times more likely to have high cholesterol, and obese students were 14 times more at risk compared to those with a normal BMI. Additionally, male students had twice the likelihood of having abnormal cholesterol levels than females. 9. Margarine. Margarine may impact cholesterol levels, and this effect largely depends on the type of fat used in its production. Traditionally, many types of margarine were made using partially hydrogenated oils, which are high in trans fats. Trans fats are known to increase bad cholesterol and decrease good cholesterol, negatively affecting heart health. Trans fats contribute to inflammation, a risk factor for heart disease, and may damage the lining of the blood vessels, which is known as endothelial dysfunction. This damage makes it easier for plaques to form and worsen atherosclerosis. According to many studies, dietary trans fatty acids at sufficiently high levels have been found to increase low-density lipoprotein cholesterol and decrease high-density lipoprotein cholesterol. It is easy to measure these effects when trans fats make up at least 4% of a person's energy, which raises LDL cholesterol, and 5 to 6% of a person's energy, which lowers HDL cholesterol. This is compared to diets that do not have much trans fat. 10. Partially hydrogenated oils. Partial hydrogenation reduces the levels of polyunsaturated oils and also creates trans fats, which promote heart disease. Palm oil and soybean oil may increase cholesterol levels primarily because of their high saturated fat content. According to the findings of several studies, the LDL cholesterol concentrations, partially hydrogenated soybean and palm oils, were significantly higher than those of soybean, which had 12% and 14%, respectively. While vegetable oil is not as high in saturated fats as some animal fats, it still contains a significant amount. Therefore, it may contribute to increased cholesterol levels, especially when consumed in large quantities or as a major part of one's diet. What lifestyle changes should we practice to manage cholesterol? As we transition from understanding the foods that may increase cholesterol, it's equally important to embrace lifestyle changes that may help manage it. These changes are not just about restricting certain foods, but about nurturing overall health. 1. Healthy eating. A balanced diet is key. Focus on reducing saturated and trans fats found in foods like red meat and processed snacks, and instead incorporate more fruits, vegetables, and whole grains. These foods are rich in soluble fiber, which helps reduce cholesterol absorption. Including heart-healthy fats, like those found in fish and nuts, may also positively impact your cholesterol levels. 2. Exercise regularly. Regular physical activity may significantly reduce cholesterol. Activities like brisk walking, cycling, or swimming for 30 minutes most days may raise HDL or good cholesterol and lower LDL or bad cholesterol. Consistency in exercise is more impactful than intensity. 3. Weight management. Maintaining a healthy weight is crucial. Even a small amount of weight loss may help lower cholesterol levels. It's important to aim for gradual, sustainable weight loss rather than quick fixes. 4. Quit smoking and limit alcohol. Smoking has a detrimental effect on HDL cholesterol, and excessive alcohol intake may raise cholesterol levels. Quitting smoking and moderating alcohol consumption may have a significant positive impact on your cholesterol levels and overall heart health. 5. Stress management. Chronic stress may indirectly affect cholesterol levels. Engaging in stress, reducing activities like yoga, meditation, or even regular leisure activities may help maintain a balanced lifestyle. 6. Regular health checks. Keeping track of your cholesterol levels through regular health checkups is essential. This enables timely interventions and adjustments to your lifestyle or diet as needed. While our guide on the top 10 foods that increase cholesterol you must avoid serves as a valuable resource for managing your diet, it's important to remember that individual health needs may vary. High cholesterol is a serious concern, and what works for one person may not be suitable for another. Therefore, consulting with a healthcare professional is crucial. They may provide personalized advice and monitoring, ensuring that your dietary choices align with your unique health requirements. Remember, taking charge of your cholesterol levels is not just about avoiding certain foods. It's about embracing a lifestyle that promotes overall well-being and longevity. Now that we've discussed the many foods that may contribute to an increased level of cholesterol, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss-related videos. Shall we? Watch 16 healthy foods that help you lose the most weight. You may also try our video on 13 weight loss tips to get rid of your bloated belly fat. Go ahead, click one. Or better yet, watch both and learn more about weight loss and nutrition. Will you be avoiding these foods from now on? Let us know in the comments below.